Hello, lovely speech therapy professionals. Today I want to discuss how to write goals for your patients. I want it to feel easier writing goals than it did for me when I was a new SLP. No staring at the screen, feeling hopeless. My name is Chung Brewer. I'm a speech language pathologist, university instructor, and author of an online course called the Adult Speech Therapy Roadmap. In a previous video, I discussed how to score and generate a quick diagnosis and plan of care on the spot while you're still in the room with your patient. In many settings like inpatient and home health, there is that really quick turnaround for assessment results. Today, let's start when you're back in your office or closet, if you're like many SLPs I know, and you're ready to formally type up the assessment report. Start with the easy stuff first, things that don't require analysis or specialized speech therapy interpretation. This is usually information you gathered for the case history, so things like medical history, hospital course, medical diagnoses, previous speech therapy goals, things like that. You could also write subjective information like the patient's job, their hobbies, caregivers, typical schedule, things like that. In general, what you just wrote should guide the reader into understanding why the patient needed a speech therapy assessment. Think about writing a cohesive story versus trying to write down everything you gathered. You want the reader to follow why the patient needed speech therapy. Why now? You already know the answer since you helped decide what assessment to choose. So here's an example. Patient is a 77-year-old male with recent hospitalization for acute CVA. During hospitalization, patient developed aspiration pneumonia and required NG tube feedings. Patient was discharged on a minced and moist and slightly thick liquid diet. Medical history is significant for diabetes and hypertension. Patient is now referred to speech therapy for evaluation of swallowing due to continued risk for aspiration. Then introduce what assessment you use. You could write something like, patient completed a bedside swallowing evaluation. If it's hard to find the right words to use, then ask a seasoned speech therapist if you could review some of their old notes and copy their format. If you haven't already, fully score the assessment using pluses or minuses when applicable, and calculate percentages. We want to add numbers to our assessment report because it's how we typically track progress, and it's what insurance companies love to see. If you did a swallow assessment, you could calculate how many sips they didn't show overt signs and symptoms of aspiration. If you did a language assessment, calculate how many pictures they correctly identified. For motor speech, calculate their intelligibility by dividing intelligible words by total words spoken. Now it's time to put on our speech therapist critical thinking cap. If this is usually the point that you dread, or your energy plunges, or you just procrastinate, let me get on my soapbox for a minute. You are the swallowing and communication expert. You have the education and the smarts to interpret the data you collected and make a professional recommendation on what to do about it. Time to write goals. You have all these numbers and calculations. Now you're telling the reader what it means, why it matters. Here's how to get into a good headspace to create goals. Think about how their scores can translate into real-life tasks. Zoom out. And remember that the job, speech therapy in general, is to help with safety, independence, and quality of life. How could those numbers you came up with impact safety, independence, and quality of life? It's going to be based on your professional judgment. So they scored 40% on single word naming. What does that mean? It probably means it's hard for them to ask for what they need. So a goal could be something like, patient will produce single words related to daily life at 70% accuracy given cues. They received a severe score on the MOCA, but what does that mean though? Think about what you could do about it as a speech language pathologist. Take the other information you gathered to help you interpret what that means. Maybe you heard from OT and PT that the patient seems really impulsive and is at a high risk for falls. That might mean they would benefit from 24/7 supervision for safety. You could write something like, patient will complete simple problem-solving tasks related to safety at 80% accuracy given cues. You see that your patient is 60% intelligible at the sentence level and 40% intelligible at the paragraph level. What do you do with that? What does that mean? First of all, remember that this is not just about intelligibility, but about the patient's quality of life. Zoom out. In this moment, does the patient have a hard time asking for basic things like, please turn off the light, or my back really hurts? If so, you may conclude that the patient has reduced ability to communicate basic wants and needs, and recommend intelligibility treatment tasks, or use clear speech strategies or simple AAC. When you zoom out and remember the purpose of the job, which is safety, independence, quality of life, then it's much easier to generate goals. Check in with yourself as you're typing your report. If you realize you've been zoomed in too long or you're getting tunnel vision, zoom out, see the whole patient, and make your best professional guesstimate on how your patient's current level of functioning may affect their safety, independence, or quality of life. On adultspeechtherapy.co, we have a list of over 150 short-term goals to help you get into the right headspace. It's a free article, so check it out. If you want a more step-by-step guide for this process, including how to score informal assessments or an oral mechanism examination, check out the Roadmap course. If you go to adultspeechtherapy.co, you'll see a link on the right side of the page. That's it for this week. I'm Chung Brewer. I hope this video can add value to your practice. Thanks so much, and I'll see you next time.